A very good morning to all of you. My name is Mrs. K. Tilaka. I'm a nursing officer from Teaching Hospital, Peradeniya. All of you are now aware of that we are discussing about diabetic food care. Under that topic, my goal today is to help you to understand how to identify and develop food ulcer as early as possible. So let me provide you with some background on what I am going to talk to you. Let's look at the presentation that I have made for you. Signs and symptoms of a developing food ulcer. That's my topic for you today. Prevention is better than cure. That's an old saying. That means if you identify the signs and symptoms of a developing food ulcer early, you can prevent the adverse effects of it that may to be happen in the future. Every diabetic patient is under a high risk of developing food ulcers. So let me explain to you about what are the changes of the food that you should be aware of if you are a diabetic patient. First of all, you should look for change in shape, color, and temperature of the food. Diabetic patients have poor circulation that may lead to poor wound healing. If you have edema in your feet, it becomes worse. So you should look for edema in your feet as seen in this picture. Then color changes. Any bluish or reddish discoloration may be an indication of food ulcer. Therefore, you should look for it. Diabetic patients are more prone to develop cellulitis. If cellulitis remains untreated, it may be leads to an food ulcer. So any reddish discoloration may be an indication of cellulitis. There is an increase in temperature of your feet if you are developing a wound. So you should feel your feet for warmth as a diabetic patient. Second one is changes in nerve sensation. You should look for changes such as burning, tingling, pain, and numbness of your feet. Third one is changes in skin integrity such as drying and cracking. Diabetic patients' skin is more prone to drying because of their high glucose levels. Then it cracks. These cracks are better ports for bacteria to enter and develop wounds. So you should look for cracks on your feet as seen in this picture. Every one of us may have calluses on our feet, but if a diabetic patient, it is dangerous because it may develop to a wound. So you have to look for them also. Fourth one is you should look for changes in blood circulation and immune system such as blisters and sores, ulcers, tinea pedis, or Achilles foot. These are the blisters. These blisters may seem as blisters from a burn, but they are painless. If any one of these blisters ruptured, it may lead to an infection. So you should look for blisters also. Athlete foot is an fungal infection. Diabetic patients' immune system is weak. Therefore, they may prone to develop athlete's foot. Imagine my hand as your feet, and these are toes. The area between the toes is the area where athlete foot is developed. So you should examine these areas. Last one is foot ulcers. Foot ulcer is an untreated to unidentified sore. These are the areas where foot ulcers are developing. You can see in this picture. It is a reddish cavity surrounded by calloused skin. So that's the end of our presentation. So let me ask a question from you. What are the changes of the feet that you should be aware of if you are a diabetic patient? Hope you all get a clear understanding about the topic that I have talked to you. Thank you for participating and cooperating with me. Have a good day to all.